So I'm going to start with something we do at home whenever we have a meal. This is my travel one. We have one on the table. And what we do is, before we start eating, we all pause, take 3 deep breaths in and out, and then we go around the table and say what we're thankful for that day. And we do this at holidays too. When like nieces come over, they actually, everyone wants to hit the bell, you know, it's like so cool, it's a chance to do that. But they really enjoy sharing what they're thankful for. And I think that's left a powerful impact on our family. So I am the director of our IBD nutrition and integrator program. I've always had a sort of interest in you know, different kinds of things. And we're turning it into like a formal program now. There will be slides later on. Oh, okay. There will be slides later on, so you can actually look at the details on there. But I'm going to kind of go through just so we have time to kind of do other things. We'll start with a case. I saw a patient came to see me. He's 35 years old, a teacher, diagnosed with ulcerative colitis 5 years ago. Was doing well on mesalamine, something like Azicol or something like that. Moved to LA and then flared 3 months before coming to see me. He got better with prednisone, so I was local GI doctor, but was really unable to get off the steroids. So the local doctor recommended biologic therapy. Now a lot of people come to see me because they don't want to do that, you know, and they want to see what else they can do. So I said, well, what did you decide? Because this was like a month ago. You know, I was thinking he's going to say, well, what can I do to avoid a biologic? And he said, I started infliximab, Remicade, and I feel great. I'm okay. So that's awesome. So what can I do for you? He goes, when I asked my doctor what else I can do, aside from just medication for my IBD, there was this long pause. He goes, I'm here to learn what else I can do. And I heard that you talk about stuff like that and things. So that's really what the patient came to see me for. And I'm starting to see more and more of those kinds of things. So beyond medication, what else can we do? We hear a lot of things from internet, coworkers, family members, stuff like that. I know things get sent around all the time. Complementary medicine, this is an older study, but it really is being used across the world for a variety of different things. Now there's many different things you can think of as alternative medicine or complementary medicine, including diet, for example. It's a pretty loose definition, but it really is utilized by a lot of people. Now there's the Eastern versus Western paradigm, right? In the Western paradigm, looks like we're popping pills a lot here. And in the Western paradigm, you kind of think of like acupuncture, stuff like that. But now that we have injectable biologics and we have little herbs and pills, I think that line is blurring a little bit. But it's an interesting thing. So complementary medicine, what is that? These terms kind of get used interchangeably a lot. Alternative medicine technically is when you do something in lieu of sort of traditional medication, right, in place of. Complementary means that you're doing it along with. And then integrative is doing it together, but in a coordinated fashion, with an emphasis, importantly, on nutrition, exercise, stress management, and strong support network. So, yesterday we talked about how there's all these different therapies we have, for treating IBD, and so why do people sort of seek out alternative kinds of things? And we discussed yesterday also like how, if you look at studies, 2/3 of people get better in short-term studies, 1/3 have a longer-term, improvement, but remission is, not quite as good as we'd like, especially long-term. And then in real life, we can kind of modify things. And people are concerned about, to get better results, but people are concerned about side effects, they're concerned about cost, and that's kind of what kind of drives things. And when we think about personalizing medicine, the medical definition is a little bit different than, I think, what patients kind of feel. But how do you choose the right therapy? Doctors think more about like efficacy. If you're really sick, you want to know is it going to work or not. You're supposed to worry about disease-associated risks down the line. What's going to happen to me? How can I prevent, a stricture or perforation or osteoporosis, something like that? Compliance feasibility, is what we recommend going to work with someone's life? Maybe the best choice, ideally, is not really going to fit because of cost or other issues there. Patients worry about quality of life, cost, and the treatment-associated side effects. And I think doctors don't quite always appreciate that. These are both long-term and short-term concerns. So how do we balance the risk? And we also take into account that not treating the inflammation adequately can predispose to complications. Strictures, perforations, malnutrition, in kids, poor growth, and even cancer, like in the gut and such. Now, many of you are familiar with the food pyramid from way back when, you know. That's sort of been, you know, replaced by, that's not really woke anymore, you know, so woke. So it's been replaced by the food pyramid, the food plate, and they look at it this way. So I thought, well, what would an IBD treatment food plate look like? So my IBD plate, the Western variant, includes things like steroids and anti-inflammatory options and immunosuppressives and biologics and experimental options, and there's always surgery over here. The Eastern variant, you got little acupuncture needles. That was supposed to be that. I couldn't find some. But so you would talk about, like, you know, diet and other microbial manipulation, which will be discussed much more, you know, today. Also, and then, you know, yoga, meditation, supplements, and herbs and stuff like that. But does it need to be one or the other? It doesn't. You know, you can take the traditional approach and sort of an alternative approach and blend them together. And when you do that, that's sort of, again, this is sort of a complementary integrated approach. That's when you can go, I think, to feeling just better, to actually feeling well, and then staying that way. So that's kind of my overall paradigm. We talked yesterday too about how there's all these different options for, you know, for therapy, and that, you know, just a few actually have sort of these more select kind of things that aren't available everywhere else, like the herbs and the, you know, the diets and the acupuncture and stress management, stuff like that. This is sort of an expanded version of the alternative menu, and we're going to touch on a number of these things today. When we think about what's the goal of complementary medicine, this complementary medicine is CAMP, you know, you want to know, what are you treating? So, you know, traditionally, we kind of think as like, oh, we're trying to just get the inflammation under control, right? We want people to feel better, get the inflammation under control. But with complementary stuff, are you know, what's your goal? Is it to really turn off the inflammation to get better? Try to turn it off completely and maybe even shoot for something called mucosal healing? Is it to maintain remission and maybe try to back off medications down the line? Is it to just feel better? You know, we don't have to do things that just get rid of the inflammation. Sometimes we're left with other issues too. We just want to feel better. Are we trying to do something about joint pains? A lot of people have joint pains with IBD, right? Or mouth ulcers. Or is it other issues like appetite, diarrhea, abdominal pain, cramping, fatigue, can't sleep at night, sense of well-being, bloating? Are we just trying to treat the irritable bowel component of things? Or are we trying to treat the SIBO, the bacterial overgrowth? So again, the goal of complementary medicine may not directly be addressing the IBD gut symptoms specifically. And what's the ultimate goal? Is really feeling good enough? And I, you know, kind of highlighted this yesterday, but, you know, here's a gentleman who was doing really well on his therapy. It doesn't really matter what it was. He felt great, labs were normal, so decided to stop it. Comes in a year and a half later, still feeling well. Dr. V, I'm having 1 or 2 bowel movements a day. I can eat a full-size meal without any problems. I eat everything. My SED rate's 9, my CRP is 1.9, my calprotectin is like not even detectable. So you think, oh, this patient is doing fine. I said, well, you know, there can be this disconnect between like what's going on inside and kind of, you know, and he's like, well, you know, I'm like, you need a colonoscopy. So I didn't quite say it that way, but the point was, when I got around the first part of the colon, everything looked really good, and then I started to see inflammation over on the right side. And then I saw more inflammation. And then I went up a little bit higher into his terminal ileum, and there was this tight inflammatory stricture, stenosis. He didn't know it. The discussion we were going to have 2 weeks earlier, when we didn't know the information, and what we have now was very different. So there can be this symptom disease disconnect, which is more prominent in ulcerative colitis than in Crohn's disease. So inflammation can smolder. I think it's really important just to understand that. We talked yesterday about the different levels of inflammation. You know, there's sort of feeling well or clinical remission, which a lot of studies are sort of based on. There's the biochemical aspect of it, like are your inflammatory markers like your SED rate, CRP, and stool markers normal. Are you in endoscopic remission? That's becoming the new standard. You know, when we look inside, do we see any inflammation or not, and how much if so? And then there's histologic remission. That's where like there's nothing going on, and no studies or very few studies actually address that. So you know, if the goal is to really knock out the inflammation, the goal should be deep remission. If you achieve deep remission, you can then usually back off of therapies a lot easier. If you try to back off before you've achieved deep remission, then what happens is that you got these embers kind of smoldering in there, and you back off and they start to kick up. Just like if you're at a campfire and you put the thing out at night if you're camping, but you didn't quite put it out all the way, and all of a sudden in the middle of the night, you got this thing kind of just blowing up this way. So deep remission is when you feel well, the inflammatory markers are normal, the scope is normal, the biopsies show no inflammation. And again, you want to make sure that the embers of inflammation are completely extinguished before you really try to back off your therapy. So how do we put out the fire within? We talked a little bit about some options yesterday. The immune system is very complicated. Dr. Gold put up like this graphic up there yesterday, and I think it's still kind of hard to follow, even though it was a very nice graphic there. So this is kind of what the immune system looks like over here. It's really complex, and it's really redundant. Actually, this is a picture of the Tokyo subway system, but the point is that if something gets blocked over here, there's other ways you can get around that. So the body's really smart in terms of how it gets around things. Now, I love the movie Matrix, and my son's a techie, so it's very, it's a fun movie. But there's this guy, Agent Smith, in there, and Agent Smith just has like one focus. He wants to create havoc in so-and-so's life, right? Very focused. So now imagine that we have the immune system. You got this little white blood cell that's really programmed to help you, but it kind of gets reprogrammed. So now it's going to cause problems, okay? So something triggers and activates this process, and now it multiplies. You got two of them, and then you got more, and you got more. They're like rabbits multiplying. And then they actually bring in other agents to kind of help along with it. So again, one of the goals here is to, whatever we do, we want to quiet down that immune response. Not overdo it, but just kind of quiet it down to the point that it's normal. You need to keep it there for a while so that when you achieve that deep remission and you start to back off your therapy, if you're going to do that, then the body's kind of forgot, what it was programmed to do, that way. If you get to the point where it's quiet, but not quite all the way out, it's kind of like taking a good sleep, but not really a really long one. You might wake up like super refreshed and reinvigorated, It probably wasn't the best thing, but you'll get the point that I'm making there. So there are also different phases of disease, and we think of them differently, How your initial presentation is going to be different than maybe a flare, which hopefully you can catch earlier than the initial presentation, so you have a chance to kind of intervene earlier. There's a fine-tuning, going from better to really well. There's the maintenance, and now people actually want to try to de-escalate or back off their therapies, And then there's things called post-op prophylaxis. So when you remove, say, a piece of really bad small intestine and now you've hooked up again, basically you've got a clean slate. It's kind of like starting all over again, and it's a chance to sort of intervene in a different way. It's kind of like if you have a snowball, imagine like a small snowball at the top of a hill. As it starts to roll up here, you could probably take your pinky and just stop it, But once it gets rolling, and now it's about this big, it'll just run you over. There's not much you can do about it sometimes. Also, we use a lot of combination therapy in traditional medicine in IBD because some things, can take, months to kick in, like 6-MP or vedolizumab, which is Entyvio. Some things take weeks to kick in. Some things work much faster, So now the same is true of alternative therapies. Some work quickly, and some take a long time to get better. I talked about yesterday, if you want to see the actual, if diet's going to be your primary modality, it takes about 1.5 to 2 years to see close to full healing in people, or full healing. And there's also sort of like this old school thought in medicine of whatever you start and whatever dose works of a medication, you got to stay on it forever. That's kind of like old school. I'm going to throw a new school here. I know not everybody thinks like this, but I do. So I think short term is like, the next couple of days, the next couple of weeks, maybe next few months. Medium term is next few months to maybe the next year or 2 or 3. And then there's the long term. And again, I think we can think differently about things now, because in the old days, we never really, before we had biologics and people were doing like diets more intensely and we could look inside and see stuff, we relied on people just sort of feeling better. And so we never really achieved deep remission in a lot of people. Now we can look inside, we got better therapies, and we can make better decisions. So once you achieve deep remission, you can typically back off of things. So when it comes to complementary strategies, I think just like regular strategies, you want to know, will it work? So in medicine, we use this thing very often called the Cochrane reviews. And what they do is they sort of look through all the literature and they rate the level of evidence, and you want to know what's going on. And there's different levels of evidence. There's like really strongly supported studies, where you got placebo controlled, you got a bunch of different studies that'll show that. And then you got things that are like, a case report where, I got better on this. We all hear how, my friend got better using this therapy and like it didn't work for me. So, there's random things like that. But some of these things in smaller cases get published too. And so, we really want to know what the evidence is. Now, let's start with herbs. There's no real evidence that herbs affect IBD, right? So there's this interesting study that was done in Europe. There's this group of patients with Crohn's disease. One group had a 73% response rate. One group had a 22% response rate. What's the difference? You go, I want some of that stuff, right? So this is actually a response to, they had the same therapy. It was infliximab or Remicade. Why the difference? Well, this group was toxin exposed, and this one was toxin free. Anyone know what this is? My uncle had a tobacco farm, so I'm familiar with that, with that. Smoking in Crohn's disease leads to more likelihood of surgery, recurrence of disease, more surgeries, perforations and fistulas, refractory disease, and you're less likely to respond to anti-TNF therapies. And I see that in real life. People stop smoking, all of a sudden, boom, they're doing great, very often. So if you have Crohn's disease, don't smoke. So herbs can affect IBD. That's a clear example of that. What about this? You think, oh, this is harmless. This is just seaweed extract. Well, we looked at this yesterday. This is carrageenan, and carrageenan can be used to create experimental models in mice. And then we talked yesterday how that one study they gave lower than normal doses of typical daily diet doses of carrageenan to individuals with UC, and they actually flared more often over the course of the next year. So. And then, there's all these other things that could potentially, so be there, but herbs aren't always benign, and that's important to realize. Now, there are a variety of botanicals that we can use. There's actually more than this that have been looked at in IBD, but I'm going to just kind of focus on these just for the sake of simplicity, and I want to kind of cover other things too. But before we jump into that, alternative medicine considerations. So the product considerations are important to think about. A lot of these things aren't regulated. Part of the plant matters, whether this is like the leaf or the stem or the roots, the flower, the bud, it matters what part of the plant. And so what you're getting in terms of like, turmeric or maybe even marijuana from one, thing and versus someplace else might not be the same thing. And they're grown in different areas. So the herb in one area might be very different qualities than the herb in another area. It really matters there. And then the other problem is like when you look at the literature, you go, well, this specific fish oil product they use or the specific probiotic or the specific herb that they mentioned isn't commercially available. Now what do I do? They use it kind of like their proprietary kind of thing. So it's not readily available. And then, so what does that do? And then there's study design problems. Most of the studies you'll see are a very short duration. They don't look at long-term issues. That's important for efficacy. It's important for side effects. Small numbers of patients. A lot of these studies have just, tens or dozens of patients if you're lucky, and they don't really get much bigger than that. They often lack placebo controls. And the reason a placebo is important is because in your typical IBD study, the placebo rate, even in really sick patients, is 20 to 50%. So, and it's a very real phenomenon. And then the background factors, aren't well defined. So, is the type of patients they were studying, how does that? Am I kind of like that, or is that a different type of a patient? And then the definitions get fuzzy. Some people confuse IBD and IBS. I've seen doctors do that. I've seen it at conferences where that kind of gets confused, and you're thinking, the speaker doesn't really know the difference between IBD and IBS. This is going to be a bit of a problem at an IBD conference. But it's not for me to go into, right? And then the response and remission parameters aren't really well defined, and a lot of times just sort of feeling better, and it's kind of based on symptoms there. So curcumin is probably the one thing I recommend the most at this point. Curcumin is the yellow pigment you find in the herb and spice turmeric, and it has different properties that are anti-inflammatory in both clinical and animal studies. There's a couple of small studies. I'm not going to go into the details, but in UC, a dose of 2 to 3 grams a day has been shown to lead to clinical improvement, even remission, compared to the placebo group. So there actually is some data in that. There's some smaller studies in Crohn's disease that show some benefit, but it's not quite as well done, that way. And they even tried like some enemas, curcumin enemas, but that didn't really seem to have an effect. But nevertheless, I think it has a potential to be helpful. But I think people get this idea that herbs don't have side effects. So when I actually talk about herbs with my patients, I do mention there's potential side effects, with that. It's a blood thinner, okay? So before a surgery or before a scope, where you're gonna get biopsies or some other procedure, you probably don't wanna be doing that. If you start getting nosebleeds, you should probably, back off the dosing. It can strengthen the effects of other blood thinners. A lot of people have, clotting issues. They're on other things like, Coumadin and stuff like that, or Plavix. It can lower your blood sugars. It can lower your blood pressure. Fortunately, we don't see these things very often. It can cause kidney stones. It can cause stomach upset. So there's other issues there. And although you can take it while you're pregnant, you can eat turmeric while you're pregnant or breastfeeding, or trying to get pregnant, it's not a good idea to take pharmaceutical doses in those situations. Other considerations: black pepper or no black pepper, because black pepper is supposed to increase the absorption of the turmeric. And if you're having joint pains, that kind of makes sense, right? But if you're dealing with a gut disease, do you really want to absorb it, or do you want it to stay in the gut and get to the gut area where the inflammation is? Studies don't address that. We don't really know the answer to that one. The formulation is important. You want to get the stuff that's 95% curcuminoid extract, so the really concentrated stuff. That's the stuff that's more expensive in general. And my dietitian did a calculation. She said if you take 3 grams of turmeric a day, that's 3,000 milligrams, that's equivalent of taking 24 tablespoons of turmeric powder. Not even my patients who have ethnic food predispositions for turmeric are doing that much. No one's putting that much in their shake. I hear that all the time. So, and then you probably want to split the dose up, again, because of the properties we just talked about. And then if you're on SCD, you want to make sure it's SCD compliant, right? I'm a big harper on that always. And here are a couple formulations that I've been told are SCD compliant. Wormwood is another one. Wormwood is in the sort of the daisy family. You see it's like in Europe. And actually the 2 studies I'm going to talk about are German studies. There's one German study that looked at wormwood in active Crohn's disease. And the group receiving the wormwood had lower disease activity and depression and increased quality of life compared to the placebo group. So again, they had a placebo group here. That's pretty cool. This one's actually pretty neat and intriguing. 40 patients with Crohn's disease on steroids. And it was a double-blind study, so patients didn't know what they're getting, the doctors didn't know what they're getting. 10-week study in Germany. And they used a preparation of wormwood, and these are patients that had already been like on things like 5-ASA products, and some of them were on azathioprine, and some of them were methotrexate. So they're not just sort of like mild patients. They're on other things too. And what happened was in the wormwood group, 90% had an improvement, despite they tapered the steroids over these number of weeks. And after 8 weeks, there was almost a complete response remission in 65% of patients. Again, it's clinical remission. And that effect persisted in the weeks following the study out to about 20 weeks, where they kind of stopped the study at that point. And no one had to go back on steroids. Whereas in the placebo group, they withdrew the steroids, and patients deteriorated. In fact, they had to restart steroids in 80% of the patients. So again, it's an intriguing study. Wormwood can have side effects. If you actually look at the studies in IBD, there's like one of the studies doesn't mention side effects at all. The other one kind of says, we didn't really see much of anything, that we wouldn't expect, just from someone being in a study. But if you look up wormwood on the and do a little more searching into it, it can cause nausea and vomiting and cramping. It can lower blood sugars. It can cause dizziness, headaches, kidney failure, restlessness, hallucinations, both auditory and visual, vertigo, and even addiction. So and you should take if you're pregnant or breastfeeding or trying to get pregnant. But so I do selectively use it, or talk about it with patients after we kind of go over everything here. But usually not more than 10 to 12 weeks, in those cases. So I think something that'd be interesting to look at, more down the line. That next slide is a mistake. Sorry about that. So wormwood, again, if one's looking for an SCD legal product, that one works right there. It'll be in the handout. Aloe vera. Aloe, it's been used a lot for getting rid of inflammation, right? You put it on your skin and stuff like that. It's not SCD legal. If you look it up, it's not allowed. So, but there was a study of 44 patients with ulcerative colitis who were hospitalized in England, and did a double-blind study, 4 weeks. And what we see here is that the aloe group had a higher response rate and higher remission rate than the placebo group. And they saw improvements in clinical scores and histologic scores, but when they looked inside, they didn't see much of a difference. Now, it may be, and just anecdotally, that with aloe, usually that takes a lot longer for it to really fully kick in. So the study just may not have been drawn out long enough. And in my personal experience, I don't really know what product to recommend, because I've got a guy who came in from Ethiopia, and he brought his aloe from Ethiopia, and he grinds it up and he takes it, and he does great with that, but not with any other aloe. Someone else goes to Trader Joe's and gets their aloe juice, and that helps them, but it doesn't help the other. So I don't have a specific. I try to, when I can, recommend specific things, but it's hard with that. And then it has some potential side effects too. It can tan your colon. It's a laxative. It interacts with a whole bunch of different drugs. You just kind of want to run that by your pharmacist maybe. And then aloe latex is a problem. Latex is, so the aloe gel is the inner part of the aloe. The latex comes from just underneath the plant's skin. It's sort of a yellowish in color. And 1 gram of latex can cause, over several days, can cause kidney failure and even be fatal. And it can theoretically cause cancer, and you're not supposed to give anyone under 12. So if you grind up the entire plant, you just want the juice. You don't want the plant, and you just need to be cognizant of the potential for problems there. I mean, we assume that hopefully that people kind of screen these things out to produce these things, but we don't always know. And you may want to be careful picking it from your garden. Boswellia is another one that's being looked at more. There actually are some ongoing studies with this in the US right now. There was an Indian study that looked at Boswellia in UC, and they found that the remission rate of the patients with UC who went on Boswellia compared to not really a placebo, but it was a group that getting sulfasalazine instead, the remission was all very similar. It was about in the 75 to 80 +% range, and all parameters improved in both groups, which seems encouraging. Then there was another study in Crohn's disease where we looked at 108 patients who were in remission. It was a 52-week study, and they got the Boswellia, and they got placebo, and the remission rate partway through the study was the same in both groups. So they actually didn't find a difference there. And they prematurely stopped the study because they thought, it's not really working. So, but anecdotally, again, so there are people that feel it helps, for things like joints and other things like that. And I do sometimes use it that way. And it has potential side effects, obviously, too. And then there's herbal cocktails. Herbs work differently in UC and Crohn's disease sometimes. One of my patients many years ago was on cyclosporin and not doing well. He kept flaring when we tried to, taper off the prednisone. And so she comes in and is like, Dr. V. She finally decided to have surgery, and it was a big decision for her. I mean, when we first met, every time I bring up the word surgery in the hospital, she would just break down in tears. I couldn't even discuss it, and it was a bit rough, So she finally makes the decision to go to surgery. And then she calls me up on Monday. The surgery is going to be on Thursday. Dr. V, I'm going to run this by you. My friend gave me some herbs over the weekend, and I started taking them. I think I might be feeling better. What do I do? And I'm like, you're really not doing that well. You know, if you cancel your appointment, it's going to be another 3 weeks or 4 weeks before you can get another one, you know. So it's going to be, we're going to have some issues there. So I said, you know, don't cancel the appointment, but call me back on Wednesday. Let me know how things are going. Dr. V, I'm feeling really good. I'm starting to feel better. I want to give this a try. That was 22 years ago. And I said, you know, I'm not comfortable with, you know, like you being on cyclosporin and 6-MP and all this stuff. So I said, let's kind of back off of all that stuff and just kind of see how you do. So it is a combination I've actually used, and there's a combination that I've used in a number of different patients over the years. It was interesting. The surgeon was scoping her periodically and said after about 20 years, you know, I mean, you've been great for the last 15 years in deep remission. I don't, you know, why are you taking so many herbs, you know? So why don't you just stop it and see what happens? She thought, yeah, that's okay. So then she had made an appointment to come see us when she flared. So it was intriguing. And she had deep mucosal healing. That's one where I would just, you know, I would want to talk to people personally if they want to try it. So brand is important versus generic, right? You know, not all acupuncturists are the same. Not all herbs are equivalent. Not all probiotics are equivalent. Not all dietary approaches are equivalent. You know, I'm preaching to the choir here. And every patient is different. You know, so people are going to respond differently because they've got different, you know, diseases or different phases of things. And not everything that's natural is okay. We kind of talked about a couple things, but for example, there are steroids, natural occurring steroids in cat's claw. Some products actually aggravate IBD. I had a patient who was flaring and just kind of out of the blue, and I'm like, well, you know, looking at the nursing intake, and I'm like, are you taking anything else? You know, I kind of went through the whole thing with Advil, Motrin, Relief, stuff like that. And she's like, well, you know, I do take a couple herbs. I go, oh, well, what are you taking? She goes, you know, it's kind of like a more than I can remember right now. I can't remember. I go, well, bring it in next time. We set up an appointment for like a week or two later. She brings in this list. She was taking 30 different things, you know? And so some of them she take all the time. Some she takes some of the time. And I said, well, what do you really need? What do you not need? And it turned out that we cut those things out and her flare went away. You know, so, and I've seen that with other things that are seemingly benign. They can kind of cause bad reactions sometimes. Even Clay set a patient off to such a bad flare that she had to go on cyclosporin and then Remicade. So things can happen that way. Other people do fine. And then, you know, everything is anti-inflammatory because you hear that all the time in the media, right? It's anti-inflammatory. So, you know, I have patients who got joint issues in addition to their IBD. So one patient started taking this white willow bark product and started to flare her colitis, Crohn's disease. But her joints were feeling a little bit better. And it turned out that this herb is actually a non-selective COX-2, COX-1 inhibitor. That's sort of like a different kind of NSAID type of drug, like Celebrex, something like that. And so that's actually what set her off into a flare. You know, so it was anti-inflammatory in the joints, but not in the gut. And then melatonin I'll talk a little bit more about later. Some products can cause, you know, GI upset. Even megavitamins, if on an empty stomach, can cause GI upset, stomach upset. Other things are laced with, like, you know, mercury and arsenic and lead and even human placenta, even street drugs. One of my friends, a physician, is Asian, and her father was taking a bunch of these, you know, herbs for something going on with him, and all of a sudden, gradually started to feel like a little bit more dizzy, a little bit more distant, and she's like, you know, what's going on? They went to the emergency room, saw the doctor, and she did a tox screen on him, and the emergency room doctor was like, you know, that's crazy, but she's like, I'm a addiction medicine specialist, you know, like, this is what I do. So just run a tox screen. Ecstasy in the system. And so she calls up the various manufacturers and found that one of the companies had changed where they were getting one of their products. And so the product had the same labeling, but where they were getting it was different. It changed. And that actually happened with another, we've had some product changes with some of the other herbs and stuff like that I've seen. So you still have to stay on top of everything, right? Just like with foods, you think, oh my gosh, this is SCD compliant. All of a sudden it changes a little bit. The label looks the same, but it's a different product. And now you're not feeling so well. Other products can cause like liver damage, kidney damage, and some are laced with prescription drugs. So, you know, when you're doing herbs, it's not like you're doing afternoon tea. It's not like you're sipping a little bit of chamomile or something like that. You're taking like pharmaceutical doses, high doses of stuff, right? So they have potential side effects and potential interactions. But they can sometimes work really well, you know, so you have to kind of, you know, weigh the risks and benefits there. marijuana and CBD, you know, it's kind of like the big thing now, right? You know, you even see things like, you know, can we use cannabis to treat Crohn's disease? And there are other articles, you know, showing that, you know, it's like the new wonder drug and stuff like that. So one of our fellows put together a presentation on this. He said, you know, marijuana won the midterm elections. You know, it really is all over the place now, at least in, you know, California and other places. You know, and it's being used for a variety of different purposes. There's the you know, the component that gets you kind of, you know, high, the THC, and there's the CBD or cannabinoid, which is non-psychotropic, and it's kind of touted for medical purposes. You know, it's in products you can buy at the stores. You know, now they have, you know, these Apple-like stores almost, you know, where they're like, you know, you walk in and it's like this whole experience, right? You know, so and you get the sense that they mount things really carefully, but you know, the dose of one CBD oil may not be the same as another one. So the milligram thing is really hard to figure out, and so it's kind of hard to do that sometimes. And there are some studies showing that in experimental models, cannabinoids can help and reduce inflammation. There's a couple studies in you know, people. There's a retrospective study, like looking back at your data, and they looked at 30 patients, and they found significant improvement in symptoms in 21% of the patients. And you know, that was intriguing, but again, they didn't really look inside. And then there's another study of cannabis where they were smoking cigarettes that had 150 milligrams of THC in them. And these are patients who have been pre-exposed to steroids, immunomodulators, even anti-TNF agents. And you know, they assessed things over time. And what they found was there was actually a drop in their Crohn's disease activity index over here, but 2 weeks after stopping it, things went right back up again. And when you look at the components of the scoring system, it was the things that are more subjective that got better. People felt better, you know. Appetite improved, they gained weight, you know. It's kind of like people had less cramping though, you know. So these are all things, but it doesn't necessarily, you know, affect the inflammation that way. There's another study looking at low-dose cannabinoid in Crohn's disease. This is a randomized study. They were getting 10 milligrams of CBD oil or placebo twice a day. And what they found here that both groups got better, you know. So again, that's where the placebo kind of makes a difference, you know, because otherwise you don't have the perspective, you know, there. So you know, it's intriguing, but I think you know, the jury is out with that still. Now, so you know, cannabinoids can improve Crohn's symptoms. I think that's kind of something that we can at least acknowledge. There's some studies showing that and some commentaries and stuff like that. But it can also have adverse side effects, you know. So it has acute side effects, chronic side effects. I'm not going to go into all those. It can affect brain development. So I'm on our school's medical advisory board, and you know, this kind of stuff kind of comes up. So there was a study looking at individuals who are 18 to 25. So not really kids, but not like, you know, older adults, you know, that way. And so some of them got, you know, marijuana and some weren't using it. And they did brain scans on these these young adults, and they found that there was actual detectable structural abnormalities in these kids. So young adults. So, you know, I mean, I approach it differently in adults, older adults, than I do in younger adults. So wait, I get myself in trouble. There's also something called cannabis withdrawal syndrome that's kind of listed there, and this hyperemesis syndrome. And we're starting to see more and more of that. And it used to be that, well, CBD doesn't do that, but now we know that it can. You know, so it's just something to be aware of. The FDA actually sent out a warning letter because they looked at products that just had CBD in them, and they did this study, you know, they analyzed it, and they found a lot of them are laced with THC. A lot of them actually have different doses than they're saying. So it's just something to be aware of. So my take, I know this letter is really small here, but you know, I've got grandmothers, I've got lawyers come talk to me and ask me about CBD. You know, so my recommendations vary with age, and I think, you know, the studies are intriguing. They show that cannabis can help with symptoms. That is, they can help maybe with cramping and appetite, general well-being. It can sometimes, like CBD, can reduce the number of bowel movements, make them a little bit more formed, maybe help with sleep a little better. So there are things that people can benefit from, but we haven't really seen that impact on inflammation. And I have patients who've been using both medicinal and recreational marijuana for, you know, it's been, you know, for a long time, and they've tried the whole dosing range, you know, from like a wee little bit, I tried a little bit, I inhaled this once, right? Versus, people who like really push the dosing limit to the max. And I just haven't seen even anecdotally dramatic effects from that. The only individual that I interacted with who said that his disease went into remission was dealing marijuana before it became legalized in California. So I have to take that one with a little bit grain of salt. All right, non-herbals. Low-dose naltrexone. Naltrexone blocks narcotic receptors. And so there's this theory that it can help for a whole bunch of different things. Actually, if you go to the low-dose naltrexone website, it works for everything really well. So I always get a little bit nervous when something works for everything, right? Like steroids work for a lot of things too, but they have a lot of potential side effects. But that being said, there are some small studies in both children and adults with LDN. It's something you take at really low doses and like right before you go to bed. And the studies, it was like a big thing in the GI meeting a number of years back where, the room was just packed when someone presented this thing. But then it was like the data they presented was just so underwhelming, I think everyone just kind of left really disappointed because we want to see like, this is a prospective study. They're doing it, they should be measuring all the stuff. And it was kind of like, well, and then they felt better. It was kind of the bottom line almost, And so it wasn't actually all that impressive. But anecdotally, when I've talked to other physicians who use naltrexone in their practice and my own experience is that, it can be helpful in selected patients, but it's really hard to tease out because most people are doing other things. For example, I have a young lady who had like just Crohn's from like, esophagus, stomach, small intestine, all the way through the colon, pretty bad. So she went on 6-MP and went into deep remission. And then she comes in to see me, kind of moves down to LA. She's like, and her mother gets on the phone. It's like, we're going to stop the 6-MP and we're going to do diet and LDN. And I'm like, well, why don't we take a look inside first, see what's going on. She actually was in deep remission. So, she switched over to SCD, strict SCD, and she was using low-dose naltrexone. And then fast forward about 2 years, she comes in to see me. Her flare started 3 months ago. She lost like 30 pounds. She's feeling really lousy. Her mom came out, started cooking food for her again. She went back on everything. And I said, well, what happened? She goes, well, I was feeling really well. I was in school. Like, life got busy. And I thought, I cheated a little bit, and it didn't really bother me. And so I just kind of like stopped doing it. And it took about 4 months for it to kind of kick in. But then she had a really, really bad flare. By the time she got in to see me, like 2 months later, there was some, I don't think it was my issue. I think she just had other things going on. But like, by the time she got in to see me, she was actually doing much better again. But she's back on her LDN. She's back on her SCD. I don't know which one it was, but it's intriguing nevertheless. Side effects, vivid dreams is probably the big one, and you can cause nausea, headaches, dizziness, anxiety, fatigue, so sleep disturbances. But I say most people tolerate it okay. I've also seen it sort of help lower the number of bowel movements in people who are like rapid transit sometimes. So I do use it sort of selectively. Usually the patient brings it up, not me, but I'm a little bit on the fence with it. I'll say, we can try it. I'm not sure how it'll work. If someone wants to start SCD, I go, you got a really good chance of responding. But with this one, maybe not so much. So it just depends. But it's part of my armamentarium, my toolbox. Fish oil. Fish oil is anti-inflammatory again. So there's a study a number of years back in Italy where they looked at kids with Crohn's disease who were already in remission. They didn't have active disease. They were in remission. And half of them got fish oil, and half of them got placebo. And they followed them out, over the course of a year. And the number of patients who had relapsed was a lot higher in the group that was not getting the fish oil. So they thought, oh, well, fish oil works for Crohn's disease. So it might help maintain remission, but not to get someone into remission. There have been a whole bunch of studies since then. They haven't really replicated that. They've been kind of like all over the board. So it's a little bit hard to know. I tend to use fish oil more when people have joint pains. But you have to be a little careful with that too. If you take too much fish oil, you can get loose stools. I had a guy who was having 9 bowel movements a day. He was in remission. 9 bowel movements a day, urgency to go to the bathroom. And it was just like driving him a little bit nuts, And so we're kind of going through everything, and he takes, I take fish oil. I go, well, how much are you taking? He goes, I take 8 pills a day. And I'm like, okay, well, why don't we cut that out for a couple of days, and then maybe if you do okay, we'll kind of add that like a little lower dose. And so, and the reason he was doing it was because he heard it was good for his Crohn's disease, So he cut out the fish oil, and went down to 2 bottles once a day. They were formed, no more urgency. So, you just have to be, again, sort of cognizant of potential side effects and stuff like that. He's using a lower dose. He's got some joint pains too that kind of help with that. Chondroitin glucosamine, again, you hear about this stuff, there really aren't any good studies in IBD looking at that. There are some joint things that can, where it can be helpful, and I do sometimes recommend it for joint pains, although it's really kind of hit or miss. Melatonin is another interesting one. There's an animal model of IBD where these mice are predisposed to getting rheumatoid arthritis. And rheumatoid arthritis immunologically is very similar to Crohn's disease. And so they gave melatonin to these mice that are predisposed to developing rheumatoid arthritis, and they got really bad joint issues, So, but then there's studies that suggested it might be helpful. There's other ones that kind of are wishy-washy. So I'm not really sure what to recommend with melatonin. I kind of say, there's potential issues. It might help. Just be careful if you're going to try it. If you start to have symptoms, then stop it. But some people tolerate it well, and some don't. And then there's microbiome manipulation. Now, there's going to be no talk on microbiome today, so I'm not really going to dive into that too much today. Fecal transplants is becoming kind of a big thing in the gastroenterology world. The studies in IBD are sort of very mixed. If you're going to get a fecal transplant, the best data often comes from like one particular donor in a group, or people who get multiple transplants. So you're exposing yourself now to multiple different microbiomes of multiple different people and multiple infection risks too. But in the short term, it's intriguing. It worked great for C. diff. The idea with Crohn's disease, it really should be done in clinical studies. We don't have long-term outcomes on that. I've anecdotally, though, had 2 patients that did fecal transplants. One thought it because it was in remission and was doing fine, but thought it would be a cool idea to do it. And this kind of before the FDA kind of got stricter. And so he got a doctor to give him the fecal transplant. He was in remission. He flared so bad. He was in the hospital on IV steroids, didn't respond to them, didn't respond to cyclosporin, ended up having surgery. We had another patient who was getting a fecal transplant from an alternative medicine doctor, so I didn't even know what it was, because we tried to contact, we couldn't really figure it out. But the patient ultimately developed really bad IBD, a flare again, colitis, and then passed away from a complication related to being in the ICU and stuff like that. So, potential huge benefits from manipulating the microbiome, but it's not without potential side effects, is guess what I'm going to say. So I think it's super intriguing. If we can isolate out what makes the difference, that'd be great. But remember too that you're not really establishing your own microbiome. You're taking someone else's microbiome and putting it in you, okay? You go on vacation someplace, and one Airbnb may be beautiful. You maybe think, wow, this is really nice. You go to another one, and you go, oh my God, where did I land? And kind of regret it. So just going to be a little bit cautious with that. Probiotics, the VSL3, it's been shown to be helpful for patients with chronic pouchitis. Probiotic studies in IBD are kind of again, all over the board, different preparations, different concentrations, different groups. So it's really hard to make any sort of clear conclusions with that. The area where I use it the most is, again, for bacterial overgrowth. And I think there it can definitely have a role. But, really one size doesn't fit all. And when you're giving probiotics, when you're giving a fecal transplant, you're giving a village, right? With fecal transplant, you're not just giving bacteria, you're giving fungi, viruses, prions, and all this other stuff too, some which we can screen and some which we don't. Just very briefly, there was these whipworm eggs that were kind of being touted for some time. The study went on over many, many, many years. Not much has really happened to it. It started 20 years ago. I'm just kind of mentioning it. I have a few patients who were able to kind of somehow get it. One was not the poster child for what it does in a good way. And one patient actually seemed to do really well with this. So, it's a little hard to say. We talked yesterday, though, about how things like smoking and stress and exercise and diet and sleep can all potentially, impact health, right? And what if we adapt things that actually apply to us for the long haul, instead of making sort of short-term approaches to things? So can lifestyle impact health and really, it does, So if we think about a plant, right? It's like a tree, right? You have, this tree. It grows in the soil, and the soil is full of all this stuff, right? And that if you grow if the tree's lucky to be in a good environment, it'll grow really beautiful and nice. If it's stuck in a not so great environment, it's not going to thrive very well. Anyone who has a garden knows about that stuff too, right? So if you look at the soil, it's composed of bacteria and fungi and minerals and nutrients of all sorts. And some soils are rich and some aren't. And it's not just that though. It's the rest of the environment too, right? The sunshine. What's the sunshine in your life, and what are the stressors? How do you react to those? Those are all balances. They can certainly affect things that way. So this movie, like Water for Chocolate, in the movie you realize that this person puts passion into their food, probably like a lot of you guys do. And I got to come up with a better example for an SCD conference, I guess, than chocolate. But sorry about that, guys. Nutrition can really impact, and so how we feel really involves the nutrients we try to inject to ourselves, right? Stressors and how we manage them, our toxin exposures, our exercise habits, sleep quality, and social and spiritual interactions. And it's really finding a good balance between work and play and everything else like that. So I can't overemphasize the importance of a good night's sleep. It improves energy, concentration, your immune function. And I'm on our school's medical advisory board, and our district was one of the first ones to adapt the iPads. And what we found was that over the number of years, kids weren't sleeping as well anymore. And I see this in adults too. So that light that gets emitted, even if they now kind of alter a little bit, it kind of shuts off your melatonin and suppresses it so that you don't actually sleep as well. So if you turn off that iPad or computer and TV 2 hours before you go to bed, many people actually end up sleeping better, and it's a better quality of sleep. So just think about that. Cut out the screen time. Sleep matters. It affects how you function, how you think. My son, his first year of college, he'd come home and he'd be like just dozing off at the dinner table, and it's just like, we saw this over time, and it's like, okay, one weekend it's fine, but he's like this all the time with us now. And it turned out that we're thinking, do we go see a doctor? I mean, we're seriously kind of getting worried about this. And then kind of in talking to him, it's like he's getting texts at 2 o'clock in the morning. He's got friends all over the country, so he knows the Facebook thing goes. Things are going off all the time. So now, with my younger son, he loves technology too. Everything's off before he goes to bed. There's no way that things can do that. My other son, we want him to get phone calls, so he uses the sleep mode, the do not disturb thing on the thing. But the difference in this quality of sleep was just astounding. He's awake now. He's alert. He's going out and doing things. More social. It was profound, the difference that a good night's sleep can make. Exercise is important. Only 1 out of 4 kids gets enough exercise each day, and probably the same holds for adults, with the TVs and all that kind of stuff. And exercise, really promotes good muscle and bone health. It's a great way to release stress. It increases your endorphins. It increases your serotonin, which can improve sleep and stuff like that. It's good for social interactions, which are super important. Lots of good things with exercise. So now we're kind of moving into the mind-body kind of experience. So in the Eastern philosophy, chi is sort of that vital energy or life force that kind of flows through all of us. And disturbances in that chi end up resulting somehow in disease over time. So the idea behind acupuncture and moxibustion and even acupressure is you kind of remove those blockages so things kind of flow normally again. So that's pretty neat stuff. So there are a couple small studies with acupuncture and moxibustion in IBD. Moxibustion is where you kind of heat the needle up, that way. But there's small studies kind of all over the board. And my overall take with acupuncture, and I actually take care of some patients who are acupuncturists too, so is that it can help with things like abdominal pain, nausea. It can sometimes slow down bowel movements or help you go if you need to do that, help you feel more rested, just feel better, sleep better. But I haven't actually seen it do much on IBD itself. I only have one patient whose Crohn's clinically went into remission, but she lived in Hawaii, so the background stuff there. Side effects, it's really operator dependent, the results of that. it does have side effects potentially. I know somebody personally who got hepatitis C from a from an acupuncture needle, and I had another patient come in for a colonoscopy, and we're kind of talking, and she goes, "Oh yeah, I was hospitalized a few weeks back, for just a couple of days for a lung puncture." A lung puncture? How did that happen? "Oh, yeah, I was getting acupuncture, and doctor punctured my lung." I'm like, if I puncture something, the reaction is going to be very different, But anyways, and then there's acupressure, where you don't actually use needles, but you kind of focus on certain things. Like my wife, if I had a headache, she knows exactly where to hit to make my headache get better. Pretty cool. Stress, right? This is a big thing. I think we got a real flavor for that yesterday. Stress really impacts all of us in a variety of profound ways. Many people feel that stress, impacts their disease. And stress really introduces sort of a cascade of events. It can create inflammation. It can impair healing. There were some punch biopsy studies where you take like the dermatologist, like little punch biopsy here, and they looked at dental students during exams and then during vacation. They healed 40% faster on vacation. Isn't that interesting? Caregivers, right? IBD affects everybody in the family. Caregivers healed 24%, took 24% longer for them to heal. So, stress impacts us all. Now, when we're faced with danger, that fight or flight response really, kicks in. And if you're looking at a saber-toothed tiger, then classic example, then you want those things to kind of get revving, because you want to you want your heart rate to increase. You want the blood to flow to your muscles so you can get away. You're diverting blood from the gut, to less, and other less vital organs to the areas that really need it in the moment. And it can be really crucial for for life-threatening experiences. But even perceived stress causes the same things. So you're increasing your adrenaline, your heart rate day after day after day. That gets into your hardwiring now. Now your overall response is different, and you've established a new wiring with that. And the negative effects can really accumulate over time. So mindfulness-based interventions try to deal with that, because no one can avoid stress, right? But you can learn how to manage stress and your stress response. So mindfulness strategies work on leading to awareness of your muscles and other physical sensations to really help you address that. Your brain can actually be retrained to have a different response. You can rewire your brain and your body's response to those types of stresses. And there are some studies in IBD showing that mindfulness interventions can help significantly with pain, anxiety, depression, mood, stress, and quality of life measures. Now, I'm not going to go into all those because I really wanted to make more of a point. I'm going to kind of go through some of the things. So deep, relaxed, coordinated breathing. We had a flavor of that yesterday, and I think when we started over here. But that slow, deep, smooth, even-paced breathing, where you're really expanding your diaphragm, it really helps, slow down your breathing. It reduces your heart rate, your blood pressure. Your body ends up releasing some natural endorphins, and it can really help with anxiety and stress. Biofeedback. I took a biofeedback course, and I'm a little bit type A in some ways. So I grew up very stressed, and my mom was type A too. Love her, but she's type A. And so I decided I was going to graduate high school in 3 years instead of 4. So I took community college classes in my junior year. And I took a class in biofeedback, life-altering. If I had to pick 10 events in my life, getting married, having kids, doing what I love doing, biofeedback class was one of the things that just radically changed my life and my approach to things. So what is biofeedback? It's where you get hooked up to sensors that can sense your breathing, your pulse, thermal sensors like on your fingers over here, and even you can do like brain waves and stuff like that. So by doing biofeedback, you learn how to sense things, and you learn how to alter them. So during my course, we had to sit there, and you had this this pulse thing on, you had a temperature thing on like your finger and your thumb, and you had to like make your heart rate go down. And when you really think about something, your heart rate goes up naturally, you know? So you actually learn what that felt like and then try to reverse that. And then, you know, when you get nervous, your skin clamps down, your temperature actually goes down, not up. I'm trying to get this thing to go up, you know? But you can actually see, you get feedback, either visual and or auditory, and you learn how to do this. And I was able to eventually learn how to change the temperature in my finger by a couple of degrees almost, you know, it was pretty cool. And I could lower my heart rate. And so what happens? Like you're driving down the freeway. I got here in traffic, you know, Boston traffic on Friday, you know, and I'm like, this is as bad as LA, if not worse. But you know, when you get all tense, right? What happens? You don't even realize it. All of a sudden, you're like super tense. So, but if you know what biofeedback feels like, you go, oh, I'm starting to get tense, right? And so before it hits here, you recognize it over here, and you can actually take measures to slow that down. Like when I get my blood pressure checked, you know, I'm always like running in last moment because I'm kind of busy, but it's not really always a fair assessment because I can just concentrate and lower my blood pressure, and I can lower my heart rate. There was a video that we watched when we did this, and this yogi kind of took a needle and just kind of put it through and took it out this way. It's pretty amazing. So I don't know, probably not. Yeah. My son certainly can. He just confesses to everything right away. So one of our fellows said, you know, boy, it sounds like the practice of Jedi Knights, you know. So you know, it's an interesting thing. Guided imagery, you know, this is where you sort of visualize something and that you get changes in your body. This will all be kind of in the handout, but it can really make a change. So if you create your environment to give you visual images of things that relax you, it'll relax you, right? So for example, my computer desktop is actually a picture of Hanalei Bay because I love paddleboarding, and that is like so cool. I have my thing over here, and instead of putting my name on there, which is what I was supposed to do, I wrote down, be present and attentive, to just remind myself that I need to do that. We went to Puerto Rico one time with the family, and just by coincidence, they gave us a Jeep. It wasn't kind of what I was expecting, and it was pretty fun. The trip was great. Driving a Jeep was a lot of fun. And so I need a new car. My wife's like, well, why don't you get a Jeep? I'm like, a Jeep? I was like, no, seriously, do it. So I went ahead and I thought about it. And so I'm at this Advent kind of party at church kind of thing, and we had to go around and ask different people like questions. And so this 10-year-old kid comes up to me and goes, if you could pick any car color you wanted, what color would it be? And I'm like, yellow. And he's like looking at me like this. And so he goes, well, why yellow? I go, yellow's a happy color. You can't get into a yellow car and get out of a yellow car and not be happy. So I bought a yellow Jeep. So, and so now I drive to work every day, and I love it. You know, like it's a relaxing, fun experience that way. Okay. So you could be walking with somebody, and you're both experiencing the same thing, but one person's mind is covered in clutter, the other one is kind of free. And so, you know, when we think about the past, there's all these different things that are there. There's guilt, stress, anxiety, you know, anger, all sorts of feelings. You think about the future. So I was like, well, what about this? You know, I'm worried about this and what could happen and all that. If you're just present, like when you meditate, you just are. You're not thinking about anything else. You're just there. You're in a really happy place. And so, you know, this is sort of another way of looking at it. And Mark Twain probably put it really nicely. He goes, a lot of the worries I had in my life, I've had a lot of worries in my life, but most of them never happened. You know, so we really do that. So meditation is an amazing experience. This is my son doing a meditation at a crystal bowl place that we went to this one time. He loves to meditate. Both my kids love it, you know. It takes effort to do it. Just got to take the time to do it, but we kind of schedule it now, so it's pretty cool. It really does help clear the mind, and you do all that breathing stuff that's really helpful that way. There isn't just one kind of meditation. I was talking about this with someone yesterday. There are all sorts of meditations. There's the breathing meditation. There's mindfulness meditation, you know, where you really focus on being attentive to everything that's going on with you. Just eating your food, you know, like the whole process of doing that could be a mindful experience. There's transcendental meditation, where you kind of focus on like one sound or one word or one phrase, and you kind of repeat it over and over and over. Some people do like, you know, prayer and stuff like that. There's body scanning, where you kind of focus on each part of your body gradually, individually, to help relax them. We did this one fun one with my son when we were starting to do it, because I knew he wasn't going to be able to relax at the beginning. So we did this one where you first tense it all up, and then we gradually relax that area. And we tense it all up, and then relax, and he loved it, So and I have patients do this with their kids, and they're like, I'm bonding with my kid, like a way I just never thought was possible. So you can do sort of this progressive muscle relaxation. You can do guided meditations. These are things you can do with tapes. You can do it on your own. You can do it in groups. We've done meditation, like there's a meditation group in the city right next to ours, and for an hour, people just get together and meditate. It's really kind of cool. So you can kind of schedule it that way. And meditation has a whole bunch of really neat effects that have been shown that are similar to what we talked about already. And then there's the moving meditations. There's like yoga, Tai Chi, Qigong, walking meditation. Walking meditation is where you just focus on your steps. And the whole process of putting your foot forward, putting it down, and that's all you're focusing on. It really can be kind of mind clearing. You don't really have to go anywhere. There's different types of yoga. I have patients who say, I can't do yoga. I've got this issue or that issue. You can do chair yoga. There's senior yoga. There's all sorts of things that you can find, to do that. They're teaching in high school right now. It's actually, pretty cool. I at some point want to try these other things, over here. But moving meditations really, again, incorporate all the breathing stuff and the meditation aspects of it, and you're teaching balance and flexibility, and you're working on stress and all that. So, and then, you can personalize it. This is a picture of me going out the paddleboard in the ocean for the first time, and it was an amazing experience. I describe paddleboarding as meditating on the water. It's like physical activity, and your mind is totally clear. The two ways I clear my mind are to go paddleboarding and skiing. When I'm skiing, I just want to get down the hill, right? And that's really all I'm focused on. No cell phone, no pager, no one can bother me. It's fun to do it with someone else. It's also fun to do it by yourself, because you really just find that kind of inner peace that way. And you can mix all these things up. Maybe one day you go paddleboarding. Maybe one day you do yoga. Maybe one day you do some meditation. You don't have to do the same thing each time. Variety is the spice of life. So I think you can see where all these things really impact things. The two I'm not going to really go into too much are social networking and support, which I think are just phenomenally important. I don't mean to not pay attention to them, but that connectedness that we all benefit from, that you guys have here and amongst your other tribes that you're outside of just IBD, are all real important. I encourage people to, they're like not feeling well, go volunteer. I know so many people with IBD who are so talented, and it just breaks my heart when they're just like sitting at home. And I go, you are so talented. Go volunteer someplace. You can really share your insights with somebody else. Get a hobby. Hobbies are great. So do those kinds of things. Social networking is just incredibly important. And then spirituality. That can, again, make a huge difference in things. So to kind of wrap it up, I think, there are things we can modify and things we can't modify. A lot of things we just talked about this morning are modifiable things, and I think that they're definitely worth focusing on. And if you incorporate them as part of a lifelong strategy, you're not just going to get that short-term feeling. It actually extends the rest of your life and has impacts in other ways. And so, how you make a good meal depends on the quality of the ingredients and how they're blended together and the chef. You have an opportunity to kind of put this all together in different ways. Be realistic about your time expectations with the different things. Give things the appropriate amount of time. But as you're going through, no matter what what you choose to do or how you choose to approach things, you have to focus also on the disease-related complications, right? So there's cancer prevention, your bone health. A lot of people don't take enough calcium and vitamin D. You want to prevent things like strictures and perforations. You need to ensure appropriate growth and development. And you want to make sure you're getting adequate nutrients that way. So I'm going to finish by saying, what does your IBD plate look like? What can it look like? Maybe combining different options, might be beneficial, because I really, again, feel that an integrative or complementary approach is what's going to get people feeling the best with the least amount of therapies and stuff like that. Thank you.